Hello. What's eating you? Psychology Eats is here to help you. Whew. What's eating you? I know these allergies is eating me. Hello, hello, everyone. Excuse me. I won't do that now. I just did it. Ooh. Anyway, we are talk tonight. Remember, July is National Black and Indigenous People Mental Health Month. And I have made a commitment to go live every night at 9 p.m. and bring you another topic about mental health services. I made a commitment to go live. I'm sorry, I just opened up my every night at come on, lady. Every night at 9 p.m. to bring you the latest and the greatest information about mental health that directly affects Black and Indigenous people. And when I say Indigenous, just throw all the minorities in that. Everybody. Black and Indigenous. And this month is being sponsored by BB Campbell. I think I've told you guys that. BB Campbell is an American playwright who has a daughter. She is BB has passed away, but her daughter Maya has mental illness. You know Maya from the show. Damn, that slipped my mind that fast. With LL Cool J, that sitcom that he had in the house, and so that is how we got to know Maya as an actress. And we also know her because of her struggle. Hi, Londell. I always say Londell. Law End. Hello, girl. We know her from the show In the House. Anyway, Maya, from the last I saw her on the internet, is still struggling with her bipolar and drug addiction. And so for the love of Maya and all other people who are living with mental illness, this month of July, we are putting the word out about mental illness and how it affects Black and Indigenous people. So tonight's topic is about insurance. So when we say health insurance, we also are talking about mental health insurance. So if you have an insurance plan, your plan also covers, in most cases, your plan also covers dental and mental health. And maybe if you need a physical therapist, some insurances even cover if you want to go to see a chiropractor, or if you want to go get acupuncture, they cover it. And so mental health is also covered under most insurance plans. But what happens when you don't have insurance? What do people do who do not have insurance, but they want to see a therapist? So I looked up the numbers to see how many of us Black folks out here that don't have insurance. So actually, Black people are not the leading group of people who are uninsured. The leading group of people, minorities that are uninsured, are Hispanics. And so Hispanics are leading that number. Not that that's like, woo, finally we ain't first in something. Oh, our number is high. Oh, we high. Our number is high, but they're the highest. So overall, there are 30 million. I heard thunder. There are 30 million Americans with no health insurance. And out of the 30 million who are without health insurance, 15 million are Black and Hispanic. So we're high in that number. 15 million. So let's just say 8-9 million Black Americans do not have any type of health insurance. And I've already talked about that we as Black Americans are living through and with generational trauma. So we need to have access to clinicians, doctors, psychiatrists, like any other group. And also, I don't know if a lot of people know this, but our babies and our moms are dying at triple the rate of white women in childbirth. So 1 out of 3 women who go to have a baby, one may die. I think that's the number. But it's a high number of women who go, and these are healthy women or unhealthy women that go into deliver their babies, and mom passes away, and so does the baby. Or maybe the baby dies and mom survives. But we are very high in that number. Part of the reason why some of our moms are dying in childbirth is because of lack of insurance. And so by the time they get to the hospital to give birth, their blood pressure is extremely high, and the baby will die while still in the womb, and then mom's blood pressure spikes even higher, and she will have a stroke or a heart attack right during the birth of her baby. Yes. So we're the worst country out of all the developed countries. Canada, China, Sweden, for example. All of these are considered developed countries like us, like we're wealthy countries. The United States is the worst. I've never experienced a mom that I've known that's died in childbirth, but I've known family members who have been pregnant with healthy babies and have lost their babies in childbirth. And it was a direct result of high blood pressure. So that's what's going on with that. So why don't folks have insurance? Well, I know there's if you live in a southern state, the South is really bad. Alabama, Florida, Virginia, name a southern state. The lawmakers in the southern states are really trying to prevent the expansion of Medicaid. Meaning, some people will qualify for Medicaid, but they're making it more and more difficult. If, let's say, you work a basic 9-to-5, Walmart or McDonald's, Burger King, Wendy's, whatever. If you work one of those jobs as a lower class, low income worker, those companies don't provide insurance. So then you go to your Medicaid office to attempt to get insurance, and you make too much money. So what the government is attempting to do, and it's up to each state if they want to do this, they're giving a wider, broader number for people. Now, let's say you can make $20,000 and still qualify for Medicaid, versus you have to make $6,000 a year to qualify for Medicaid. Now, those numbers all depend on your state. But if you are living in a southern state, please get out and vote. Vote these legislators out of office who is not willing to expand Medicaid, who is not willing to make the Affordable Care Act affordable for people. When you are right, those same lawmakers have top-notch insurance for life. It is crazy to me that you can deny me insurance, but yet the insurance that you have is paid by me as the citizen, and you would deny the people in your district basic health insurance. We are the only developed country who does not offer universal health care for its citizens. We are dying and suffering for illnesses that can easily be fixed. You know what I mean? So this country, like, it all comes down to voting. And if you are living in the South, you got to get out there and I don't know, march, write letters, do what you got to do to get these lawmakers out of office who is denying the people the right to affordable health care. So when I took a poll on my community tab to see kind of where people are with their insurance. And for some people, I think it's about half and half with people who have insurance. And I think, thank goodness, because of President Obama and the Affordable Care Act, now you can go to the marketplace and purchase health insurance. And of course, the Republicans are trying to make that even more difficult of a process. It's just insanity. Hi, Martina. It is absolute, hi, Princess. It is absolute insanity, and it's ridiculous. So back to mental health and what we can do. We have a Democratic governor. I have medical insurance with my job. Thank goodness. You're one of the lucky ones. But I know, people who have their own businesses and they don't have insurance. Even as an adjunct professor, I don't care what college you work for. If you're an adjunct professor, we're part-time professors. We are not offered any benefits. We get nothing. If my dean is listening, we get nothing. We don't get PTO. We don't get time off. We don't get a dental plan. We get nothing. I've worked with numerous adjuncts who they work different colleges and they make a decent salary, but without insurance, they can't even go get their teeth cleaned. They can't even get their teeth cleaned. So they have to have another hustle. Like a few of our, one of our grocery stores out here is called Wegmans. Wegmans offers insurance, like I think your first day of work, and it's decent. And I've known adjuncts to get a job at Wegmans. These are people with doctorate degrees, and they will stock shelves at night at Wegmans so that they can have insurance because they colon is about to fall out. Or they go to Amazon and work a night shift at Amazon just so they can have health insurance. It is ridiculous. So what do we do in our field for people who don't have insurance, but they need to talk to somebody, they need therapy, they're going through whatever? And I've already said a zillion times that as Black people, we have generational trauma. We live with stress. Being Black, we live with stress. I just watched a TikTok of somebody that I know. Her and her daughters were shopping and got accused of stealing. This is somebody I knew years ago. But anyway, they got accused of stealing. And these people are quite wealthy. They don't steal. They don't have to. They got money. So anyway, they got accused of stealing. How stressed they were when the police came. So as Black people, we live with this constant stress. There was just a video out of a town near where my sister lives, maybe 5 minutes, where this white guy has been torturing the neighborhood. And it's a neighborhood of townhouses. And he called this man, his neighbor, all kinds of Negroes. Nigga, Negro, nigga. I mean, you name it. He went on and on and on. Monkey. Well, Black Lives Matter and everybody else in the neighborhood came and they just went off. And they ended up arresting the man. And it's just a big mess right now in that town and with this guy. But it's ridiculous. I'm just saying the trauma. We live with this stress as Black people and Indigenous people with this constant sense of stress. And where do we go for help? Let me see. Martina says, my mom's coworker is RN and suffering from cancer, and she pays for treatment out of pocket. She had to switch jobs to get a better salary. Oh, absolutely. Absolutely. I know someone that I work with, and she's a therapist, and she got cancer, and she had to do several like GoFundMe's just to pay her bills, just to continue to pay into the insurance so that she can get her cancer treatments, you know, or she would have died. She would have died. If people didn't help her, she would have died. Yeah, did you see that? Yeah, that was near, not far from where the neighborhood where my sister lives. In Jersey. Yep. And other people have come out and said this guy had been torturing them in that neighborhood and a previous neighborhood for years. Oh God, like the nerve, the gall, really. So they beat the police, and that's another thing. It's funny how the police protected him. Like they arrested him to protect him. And 3 years ago, this same guy was, my sister had put an article on Facebook. The guy had been arrested for, I think he was in an armed robbery or something. He's a menace to society. He should be off the streets. And then he tried to say he wasn't racist. Really? You know, I think I might put that story on my page. I think I did. Did I put it on there? You know, he's just, you know, a big mouth, think he know everything. Well, they don't tore his house up, threw shit at his house. A mess. And he deserves everything that he's going to get. Everything that he's going to get, because it was just stupid. He's been disrespectful to women and everything. But that goes back to our stress as being Black folks. And our stress needs to be treated just like anyone else's. So if you don't have insurance, what do you do? Well, I found a good article that gives some advice on how people can have access to mental health treatment if they don't have a typical insurance provider. So one thing you can do is seek out private therapy. Now listen, private therapy is pretty expensive. Private pay is pretty expensive. So you can look, private pay can cost you between $100 and $200. Now I've had people pay private pay because they don't want to use their insurance for mental health, because they don't want it to get back to their job. Even though it's confidential and your direct supervisor wouldn't know that you use the insurance for mental health. Some people have like a phobia or fear about that. So I've had people come to clinics where I've worked and they have insurance, but they won't use it. So they pay out of pocket, which is like $100 an hour, $200 an hour, depending on the office, depending on how you negotiate the cost. I have friends who have private practices. You know, it depends. They can charge somebody $50 an hour if they want to. They can charge whatever they want. Private pay. And then so it within all counties there are mental health departments, Department of Human Services. And those departments will oftentimes divvy out money, federal money, to smaller agencies like Salvation Army. It depends. They're all different names of different agencies that have these contracts. And so you may be able to get low cost or free insurance from one of those low cost mental health service agencies. You can contact, and I'll pin this phone number after this live is over. You can contact the National Alliance on Mental Illness, and they have a helpline that offers free assistance and advice 24 hours, 7 days a week. I'll pin that number. So within your city or your state, they should be able to help you. They may say, oh, well, agency A, B, and C has free spots open. So you can go in and get free therapy for 3 months for free. So you can take advantage of that. Another good idea is to contact a hospital, because sometimes they have programs where they are training new therapists or new psychologists or new doctors, and you may be able to get an appointment with them. Any nonprofit agency may be able to help you. So look out for some of the nonprofits. I've worked for many nonprofits, and they do provide free counseling services. I mean, you have to meet some criteria, but I know if I'm usually we can make it fit. We'll make it, hopefully we can make it fit. And you will you'll meet the criteria. You'll be able to get mental health services. And then most jobs, even if you work at Wendy's, McDonald's, or Burger King, they have employee assistance programs. And so you can, go to usually they have a phone number for their employees. So you don't even have to tell your supervisor, like, yo, I need help. I need to talk to somebody. I'm having thoughts of suicide. I'm depressed. I'm calling out of work a lot because I'm depressed. You can find that employee assistance program phone number and call directly your employer, and they will tell you how they can help you. And that's available to people. And then disability benefits. Now, I think I'm going to do a separate video on how to get disability. I think I will. Some people have a chronic mental health issue that does not allow them to work consistently. They try to get a job, their depression gets bad, they quit, then they get another job, they're manic, they quit. It's just been a cycle. They're in and out the hospital. Maybe they tried to kill themselves a few times, and it just doesn't work out for them in the workplace because their illness gets in the way. And I know that's hard for a lot of people to recognize that, because they don't see brain illnesses the same like you see health illnesses. If somebody told you they had cancer, and they were applying for disability, most of you wouldn't, people don't have a problem with that. Like, I understand you want to get disability, you can't work, you're sick. But when people say they have a mental illness and they're seeking disability services, people are quick to be like, you just lazy. You lazy, and that's why you're not working. You're lazy. And that's not the case. So I am going to we have the whole month. We got the whole month. I'm going to do a separate video on how to get disability services. It ain't easy, but I can talk about it. How to get disability services, especially if you have a child in your life, an adult child, and they work sometimes, then they don't work. It's just a whole mess. Right. Say he wasn't ready. It's just a whole mess. Like, real, Lawden, it's difficult when you have chronic depression to be able to work consistently. It really is. Because your depression will tell you, F it. Stay in the bed and sleep. You get up when you get up. And then you miss your jobs. Hi, Sonny. And then you miss work for 3 or 4 days and you get fired. And then, you get a little better, you find a new job. And then next thing you know, you back in the cycle of depression and you can't work again. So I'm going to do a separate video on how to get disability services if you have a chronic and severe mental illness. But that is another option, because once you get disability, you will be eligible for Medicaid or Medicare. And that depends on how much work history you have. But I'll do a video on that. And then another way to get a mental health services, like I said, you can negotiate with a private therapist. So you can say to the private therapist, I really would like to come in and see you. I know your fee is $100 an hour, but I can't afford that. Will you take $50 an hour? And I know therapists who would do that. They will do that. Now, I don't have a private practice, but I know many people who do have a private practice, and I know that they will definitely accommodate someone in that way. Also now available for a lot of people is telehealth. Now, I wasn't a big fan of telehealth before the pandemic. It was starting to get feet. Like, it was starting to kind of build up. Even in the practice where I was working, we had a few people who we were setting up for telehealth. I think both of them, a couple that they had agoraphobia. So they didn't want to leave the house. Not that they didn't want to, they couldn't. Their illness won't allow it. So, but I was totally against telehealth. I was like, I need people. I need the person to be in the office. I need to read their body language. I need them in the office. Telehealth would never work for me. This is me before the pandemic. And then when the pandemic hit, I did a little bit of telehealth and it wasn't bad. It's still not my choice or what I would want, how I would want to provide service, but it's not bad. It's not. And, you can get appointments with someone doing telehealth for as low as $65 a month. So yes, telehealth is available. And like I said, I'm going to post how you can get free or very, very low cost, as low as $5 a session. I'm going to post the National Alliance on mental health phone number so that you can contact them if you are in need of health insurance. But remember, there are over 15 million, 30 million people with no health insurance, which includes mental health insurance. And out of that number, 15 million are Black or Hispanic. And as a result, we don't have health insurance. Not only health insurance, we don't have mental health insurance. So that's it. If you didn't catch this video live and you're watching the replay, you can put in the comment section any topic that you would like for me to cover this month. That's a lot of people. Yes, Princess. A lot of people don't have insurance. They don't. Thank goodness. I mean, President Obama, before he left office, he expanded the coverage that we could give our children. So my kids can be under my husband's insurance until they're 26 years old, because they work in jobs now that don't offer insurance. So without being under my husband's insurance, they wouldn't have insurance. I wouldn't have it. Because like I said earlier, you know, I'm an adjunct professor, and adjuncts, we don't get insurance. We don't get any health benefits. We get nothing. And then when I am working in clinics, I'm working, by the hour or whatever. So I may negotiate I'll see 10 clients a week or 30 clients a week, and I'm only going to be paid by the clients I see. But that doesn't include any type of benefit package, right? Nothing. I get paid by who I see. And so as a result of that, I don't have insurance. Right, Princess? They don't care. I'm blessed that I can do that because my husband has really great insurance that covers the whole family. But if I didn't have him, then I would be active. I would have to work a job that's going to offer me insurance. I would have to, right? So that means I would have to go to Wegmans and or a grocery store or wherever, or work in a hospital somewhere in my field. I can get a job in my field with insurance, but I would have to work somewhere with health insurance. And for a lot of people I know, they might have to take like a side job or something just to be able to get insurance or be able to pay for the Affordable Act insurance programs, which after President Obama left office and that buffoon took over, he messed that all up. And now, if you have insurance through the Affordable Act program, you know that the premiums have gone up really high, and it's more expensive because, these insurance companies, if you let these insurance companies, run amok, they don't give a damn. President Obama was trying to control the premiums. He was trying to make it affordable. And the insurance companies now are, they just was able to do whatever they wanted during that man that came after Obama, during his reign of terror, they were just running amok. So now President Biden, hopefully, and they barely cover anything. Yes, it's crazy. They're high and they barely cover anything. The push really is for universal health care. Health care that will cover us all, everything we need. And we will be a much healthier country when everybody is covered under health insurance. It makes sense. People are showing up at the hospital half dead when had they gone, when their illness just began or whatever, they could have helped them, and prevented a lot. So the push is for universal health care. And I mean, I know I'm praying that it happens for all of us. Everyone should have access to health care. We are the only developed country in the world that does not offer universal health care. Every other developed country, Canada, India, Switzerland, China, they all have universal health care, and it works perfectly fine over there. Perfectly fine. Everyone's happy. They go to the doctor's office when they need to. They get the care they need, preventative medicine. But here we are, sick over here in the United States. Black women and babies are dying. Oh, okay. I just got my little niece fell or something. She was in the hospital and her mom just texted me and said she was fine. Ugh. They know not to tell me nothing because, girl, I will be 4 tires down at the hospital. So she just told me, chill out. She's fine. But yeah, it's crazy. It's really bad. It's really, really bad. And people are suffering, and they'll continue to suffer without health insurance, without mental health insurance, until we get some of these politicians out of office, politicians that have health insurance, like the baboon that just left office. We will give him and his family insurance until the day they go to heaven or wherever they end up. They will be guaranteed health insurance. What job offers that? After you leave a job, you lose your benefits. Nope, not if you're a politician. You forever have your benefits are covered. And, the hell with the rest of us. Which is why you see so many, we see you go to New York or you go to a bigger city and you see people living on the street who are mentally ill, obviously mentally ill, and not getting any kind of health care. They don't have any kind of health benefits, health care. They have nothing. So they just show up in the hospital sick. I don't think it's fair either. Definitely not fair. So unfortunately for us as Black people, we put our mental health on the back burner. Like oftentimes we have just learned to live with trauma. We've learned to live with trauma. We're right now, the hot topic story is Sha'Carri. And Sha'Carri, the young lady who was attempting to get into the Olympics, and she's the runner and all of that. If you look at, and she hasn't told us a lot about her life story, but kind of reading through the lines of, what has happened to her. I mean, her birth mom, and just referring to her mom as my birth mom says a lot. Does that say that this lady didn't raise her? She didn't know her. Sha'Carri didn't know her birth mom. And that's traumatic for any child, not to have that connection to their birth mom, especially if she's kind of around, but you don't know where she is. So there was some trauma for Sha'Carri that nobody is really talking about. They're just talking about, oh, she smoked a blunt or she ate an edible. And where's the compassion for her finding out that her birth mom had died from a reporter who was talking to her while she was in Oregon training. I don't know why he brought. I don't even know how that conversation. He said to her, "Did you know your birth mom died?" Like what? How did he know that? It's almost like a setup. To me, it felt very set up-ish. It really felt like the enemy, people that she compete against was in her business, finding out her background, found out something about her birth mom, whatever the situation was, told that reporter, say this to her. Tell her birth mom died. And then they just happen to, after she finds out that information, she just happens to go back to her hotel or wherever they were staying, Airbnb, I don't know. And then we just happened to be there at a moment when she was very vulnerable. People are nasty. People are that petty, especially in athletics and the Olympics and trying to win your spot in the Olympics. That felt very much like a setup. Very much like a setup. What reporter, why would you say that? Why would you say that? She didn't say, oh, guys, my mom died today. Well, prayers for me, my family, my mom. She never said that. When that reporter said to her, your mom died today. What? She was like, what? Then we'd happen to be near her. That was a setup. That was a set up. They set her up. And unfortunately, she took that bait because of her generational trauma. Watch my video. I'll put a video up about it. Watch my video. Because of her generational trauma and not dealing with the trauma that she had been through, not having her parents, because where was daddy? Right. Why didn't she write, Dolores? Why didn't she hear it from her family? Because the family was probably not in touch with the mother. Now, as Black folks, usually we stop messing with you when you on drugs. So I'm putting 2 and 2 together. 2 and 2 is 4. 4 equals we don't mess with you because you on drugs. I'm gonna tell you that right now. I'm dealing with a similar situation. Similar situation. Not with my mother. No. Something else. But when you running and you on drugs and you don't drop these kids off and you ain't taking care of your kids and your kids are sitting here traumatized because you're not in their life as their mother. No. So I'm putting these pieces, I'm talking about Sha'Carri now for anybody who's just coming in. Go back in the beginning of the video if you want to know how to get insurance if you don't have insurance, or you want to get mental health treatment and you don't have insurance. I already talked about that. But for Sha'Carri, the fact that this reporter brought up something as traumatic as that to her during a very important time in her life feels like a setup to me. And unfortunately, we as Black people don't get the help that we need early on. Now, I don't know if Sha'Carri has had mental health services growing up. Has she dealt with the loss of her mom? Does she know who her father is? Now, I say that because when she won that big race and she ran through the stadium, she ran to grandma. Where was daddy? Where was the father? So, any Black father I know that got a child that's, I don't care if they want a kickball match, they gonna be there for that. They're going to be there for that. And they're going to be clapping and carrying on. She ran to the arms of her elderly grandma. That was who was there that we could see. So, you know, where is her treatment? Where is her support for Sha'Carri? So hopefully, you know, during this time that she's not, as an athlete, she's always going to train. That girl probably is running right now. So she's going to come back with a vengeance. But, and however, I would love to know the timeline, I want to know who investigated about her family. Because, you know, as Black folks, we don't tell that kind of business. Sha'Carri wasn't sitting around telling them other athletes who I'm sure had their mommy and their daddy and everybody that supports them at practices and all that. I'm sure Sha'Carri didn't say, I don't even know where my mom is, and I don't know where my dad is, allegedly. So that means people watched that situation, they figured it out, they investigated, they found out her family business, and at the right opportunity time, they used it against her. Now, maybe had she had some support, mental health support, she would have had built up enough resilience to be able to handle questions like that, or to be able to handle her emotions when she was triggered by trauma. Not having your mom in your life, and especially, if she's kind of around but not around, is triggering, is trauma. Very traumatic for her. So I hope she'll get the help she needs. And I hope she doesn't use substances as a way to deal with her pain. Because then she's probably going to repeat generational addiction if she uses any substance to deal with her pain. She's going to rely on that. And then that's just going to be a whole nother mess for her. So hopefully she's going to get mental health services. Somebody's going to, she'll be able to talk with somebody. She'll be able to talk to somebody about her pain, her childhood pain. So that's why, mental health services are important to Black people. And I'll repeat this, July is National Mental Health Awareness for Black and Indigenous people. So I will be going live every night. I don't care if nobody's in here but me and Linda and Princess. Because sometimes it is. And Martina and a couple other people. I appreciate y'all. I wish it was more people. I wish more people would watch my videos. Please share them. It's really giving genuine information about mental health services. We need it, right, Princess? We need to spread the word about mental health services for Black folks and Indigenous people. Maybe I'll do one video just on Indigenous people, because this July is covering Indigenous people too. So I got the whole month to come up with stuff. I got the whole month. What the heck did I say I was going to do tomorrow? I wrote it down. Look how I'll be writing stuff down on little strips of paper. It is important. Thank you, Dolores. Thank you. I know we all love drama, tea, and all of that. We love that too. We sure do. But I got to give the people the real tea on mental illness and mental health. I got to keep doing it. So we are covering this all month long. I don't know what I'm doing tomorrow. I should be able to do it as long as I take a nap. I almost backed out tonight because I didn't get my nap in. But I took like a small nap. But I said, nope, get yourself together. You're doing this, because I don't drop this many videos, but I said, I'm doing it. So tomorrow, look out for me again. Sometime tonight, I'll probably drop the teaser on what I'll be talking about for tonight. I had a good subject for tomorrow. I can't remember it now. I hope I wrote it down on a piece of paper somewhere. But I thought it would be something that maybe people would like. Am I talking about addiction? Oh, I know what it was. How do I get my Black man into therapy? Something like that. I'm glad you did this video first. Thank you. I think I'm going to look at how to get your Black man into therapy, which is not easy. Usually the only way to get a Black man into therapy is if you're threatening to leave them. They'll come for that. Or if they're mandated by the law, like probation, they'll come in for that. And they got the biggest attitude when they come in for that. But they'll come in for that. And then I'm going to be talking about how addiction plays a role in our Black communities. Addiction, and I might share a story about someone close to me who is dealing with addiction. I may share a little bit about his story, but he's actively using right now, so I might talk about him and how it has really devastated our family. Well, that might be an exaggeration. It's devastated his life because we have learned to say, do you, boo? And I'm going to talk about how you, at some point, when you're dealing with somebody who is actively in their addiction, you got to let them do what they're going to do and not enable their behavior. So I'm not the type to kind of enable that type of behavior. I'm quick to say, you be all right. But at the same time, I'll call and try to get you some help too. But I'm going to I'm going to talk about that during this month, sometime during this month. And that's it. That's all. That's all I got for now. But thank you for everyone who came in to listen. I will pin the resource for anyone to use if you don't have health insurance, but you need mental health services. It's out there. Don't worry about how many people come. Continue to share. It might help someone. Thank you, Dolores. Absolutely, I will. I definitely will. But thank you, everyone. I'm going to check on my niece now. They just texted me and said they gave her stitches. So I got to call my girl and see what happened to her. She's only 3, but you think she at least 10 the way she talked. So I got to call to see who she going to blame. It was probably her own fault, but she going to tell me somebody pushed her. So I got to call her now and find out who pushed her and who she want me to punch in their face. Because she going to tell me to get them. So thank you, everyone. Good night.